You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Good morning, everyone, and welcome to the Health Hub. I'm Kathy Biasi, your host, and along with our producer, Alex Diaz, we would like to welcome you to our show this morning. Good morning, Alex.
Good morning, Kathy. How are you doing?
I'm well. How are you?
Not too bad. Pretty good. Just powering through on a couple of things, but all is well.
Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook. We are at the Health Hub RMC in all three locations. We're constantly giving you updates on our upcoming shows, show guests, some tips, health tips, and so forth. And just all in all, a feel-good place to come. And please do feel free to email us at thh@radiomaria.ca if you have questions you'd like to pose to us, show guests, any show topics. We always welcome, and we do our best to try and make you happy. And please do subscribe to our podcast. We are the Health Hub on iTunes, SoundCloud, and all your favorite podcast platforms. And you can also find our podcast on the Radio Maria Canada website, which is radiomaria.ca, and on my website, which is kathybiasi.com. So today our show topic is surrounding suicide. And I just want to give you, from a Canadian perspective, some hard facts that come from our government site, canada.ca. Approximately 11 people die by suicide each day, which, if you do the math, works out to just over 4,000 deaths by suicide a year. About 1/3 of the deaths by suicide are among people 45 to 59 years of age. That may come as a surprise to a lot of people. I know we do focus a lot on suicide in our youth, but there is a definite pattern for people in this age group. And suicide is the second leading cause of death among our youth and young adults aged 15 to 34. And suicide, this is one that I was a little bit surprised at. Suicide rates are approximately 3 times higher among men compared to women. So maybe some of the ideas we had about suicide may be a little bit different when you hear these numbers. And if we continue to dig deeper and look to those who have had suicidal thoughts and who have planned out or attempted suicide, the numbers are still more sobering. Approximately 11.8% of people questioned reported thoughts of suicide in their lifetime. That number to me was very, very high. People who have planned suicide, so have gone beyond the thought to planning, is about 4%. And of that 4%, 3.1% reported having made an attempt to take their own life. This is a serious health subject, and this health issue that we're going to be talking about, mental health, suicide, deserves our attention, and not just because of the numbers and the statistics that I read off to you, but perhaps because our current approach and thought processes and attempts at dealing with suicide, we may be missing the mark. There may be something more involved here. And to that end, we have a wonderful guest, Dr. James Greenblatt. He is a pioneer in the field of integrative medicine and has treated patients since 1988. After receiving his medical degree and completing his psychiatry residency at George Washington University, Dr. Greenblatt completed a fellowship in child and adolescent psychiatry at Johns Hopkins Medical School. He currently serves as the Chief Medical Officer at Walden Behavioral Care in Waltham, Massachusetts, and serves as an assistant clinical professor of psychiatry at Tufts University School of Medicine and Dartmouth College Geisel School of Medicine. Dr. Greenblatt has lectured internationally on the scientific evidence for nutritional interventions in psychiatry and mental illness. He is the author of 7 books, including Finally Focused, The Breakthrough Natural Treatment Plan for ADHD. He is the founder of Psychiatry Redefined, an educational platform dedicated to the transformation of psychiatry, which offers online CME-approved courses, webinars, and fellowships for professionals about functional and integrative medicine for mental illness. This will be an extremely informative and an important show, and it's something that I hold dear to my heart. Mental illness in all spaces is something that needs to be discussed more openly, and I think conversations like the one we're about to have are very, very relevant. So please do stay tuned. We will be back shortly to talk to Dr. Greenblatt.
Creator of the universe, the maker of my soul, you see me. The God most high, the Savior of the world, you see me. Every affliction, stress of my soul, the deepest of struggles that no one else knows. Hear every cry, and you bottle each tear. You are the God who sees me. When my faith is dim, fear comes creeping in, you see me. I can trust in you, my times are in your hand, you see me. In every affliction and distress of my soul, the deepest of struggles that no one else knows. You hear every cry, and you bottle each tear. You are the God who sees me. You've searched me, and you've known me. You've seen me, and still you love me. You are Lord, and you I will trust.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back, everybody. Please do follow us on our social sites. We are on Twitter, Instagram, and Facebook, and we are at the Health Hub RMC on all 3 locations. Dr. Greenblatt, I'd like to welcome you to our show. Such an important topic, and I greatly appreciate you taking the time to be with us today.
Thank you, Kathy. My pleasure.
How did you get into this area of mental health? Is this your primary work, or is this a passion that you've come into recently?
No, actually, I went to medical school 40 years ago, interested in nutrition and brain function. And that was why I wanted to be a doctor, and ended up coming out, 9 years later as a child psychiatrist prescribing medications. And it was only a couple of years of traditional psychiatry where I was able to get back to kind of the roots and what drove me and motivated me. And so for 35 years have been both researching and training doctors in how to understand how nutrition affects mental health and mental illness.
So I'm thinking 40 years ago, as a man going into the profession of psychiatry with a focus on nutrition, you were a bit out in left field to most of your colleagues?
To most, we had a few, and we actually set up, I remember, an elective in the medical school called The Evolution of the Biomedical Model, where we brought in speakers on acupuncture, nutrition, but it was an afternoon, club versus anything that was integrated in the curriculum. But there were always a few, and the interest and the research has just grown now where it's established, although clinically it's still lagging behind what we know as good science.
Mm-hmm. Now, this is in the area of mental health proper. Have you seen a strong move? We tend to think that functional integrative medicine is something that's more of a newer field. Obviously, it's not. What has really grabbed a hold of doctors in your profession to make them, make their eyes open to the fact that something's missing in treatment?
Well, I think a number of things. One is many of my colleagues had illnesses themselves, weren't helped by a traditional doctor, went to a functional integrative physician, and their aches and pains or illnesses resolved. And so they started thinking about their profession. And the other is kind of the growing research base, particularly around genetics, epigenetics, and things like the gut microbiome has taken the academic psychiatric community, by storm. And so there's some things that are kind of well accepted and people are interested in. Although what's most frustrating for me, there's some simple concepts like nutrient deficiencies that still has really not penetrated traditional psychiatric models. And I think sometimes the answer is because it's too simple and it doesn't really fit the paradigm of medications and pharmaceuticals as the core treatment for mental illness.
Do you find that in the area of mental health, we see a lot more systemic integrative functional medicine sort of below the shoulder area? Do you find that the mental health area is late to the party?
Absolutely. One of the terms I keep using is, psychiatrists, forget there's a neck, connecting the body to the brain, that, if our thyroid is off, if we have any inflammatory illness, any other nutrient physiological process in the body, it affects the brain. And yes, psychiatry has lagged behind some of the changes in terms of lifestyle and prevention that we now talk about with cardiology and even oncology.
You talk about the black box warning. This is probably a term it's new to me and might be a term that's new to a lot of our listeners. And it's more in association with antidepressant medications. Can you explain what the term is and how you have sort of worked this into the way you focus on your practice?
Sure. The black box warning is is what the FDA would put on any medicine where there's a serious contraindication. So, and in my world of psychiatry, there is a black box warning on antidepressants. And the warning is these medications can contribute to suicidal ideation. And as a traditional psychiatrist, patients are presenting to us, whether it's in a hospital or in our office, depressed and suicidal. We have to share with the patient or the parent that we're handing them a medication that has a black box warning, which is the strongest the FDA could give, that says that it could increase suicidal ideation. And so it's a very awkward situation that's often ignored. And one area of work that I've been involved in for many years is looking at kind of medical biomarkers for suicide prevention and not understanding the relationship that antidepressants actually can contribute to suicidal ideation has really been a tragedy. Now, it's not everybody, but it's important that we understand it, and it kind of intersects with my work with nutritional deficiencies affecting mood. And we've found those individuals that are deficient in certain nutrients have much higher rates of the suicidal ideation with these antidepressant medications.
So you definitely integrate medications into your practice. This is not a stand against medication. What's interesting, and it goes beyond the field of mental health. Many medications impact nutrient absorption. They can have an impact on and decrease the likelihood of nutrient deficiencies. And genetics we have in there too. So are these the two fields that you're focusing on? If you need to put somebody on an antidepressant or on a medication, are you looking to certain functional tests pre-prescription or in correlation with the dissemination of the medication?
Yeah, I mean, I think, I wish it was cookbook. I wish it was simple. The brain is complicated and mental treatment is complicated. And I have colleagues who are just in this hardcore psychopharm, camp. And if one medicine doesn't work, you had 2, 3, 4, and patients are coming in on 5. And then other colleagues are just starting that same list of supplements, give vitamin B12 and 5-HTP and take vitamin D. And our work is really in the middle. It's a functional medicine model, means we're looking at root causes. And it's an integrative model. So we want to do testing to make sure there's not anemia or thyroid problems or B12 deficiency before we would start a medicine. And if we do start a medicine, we want to make sure there's no side effects, whether it's decreased libido, weight gain, or suicidal ideation. So medicine can be incredibly helpful for those struggling with mental illness, but it needs to be kind of monitored and integrated with a very kind of aggressive nutritional, personalized nutritional plan based on some of the routine testing I discussed.
Are you seeing a rise in the rate of suicide?
Well, it's been dramatic over the past 30 years across all age groups, younger ages. I just had a 14-year-old girl from our hospital, took a serious overdose and was in the ICU. We didn't see 14-year-olds overdose 10 years ago. So younger age of onsets increased 30%, some age groups 60 to 100%, and it's across the globe. That's pretty dramatic and a public health problem that I don't think we're addressing in the manner that we need to.
From your perspective, from an MD as well as a functional practitioner, is it a cohort of all different reasons, or are you pulling from your research and clinical practice some underlying factors that you're perpetually seeing?
Yeah, I think that for years we've known the risk factors, but in those 20 or 30 years, we've known the risk factors and treated those, the rates have continued to skyrocket. So whatever we're doing, it's not working. And those risk factors might be treating depression. So we have these depression screening. We have more medicines. It is, histories of substance abuse, of loss, of trauma, all of those kind of psychosocial risk factors. What I've been frustrated about is nobody's really addressing the biological risk factors, those biomarkers that differentiate those that become depressed, become distraught, and out of despair, think about taking their lives. But there's a subset that actually have the lack of impulse control and the ability to just take that gun or jump. And I believe those are biomarkers that we now have available to us, and that research has been around for 30 years. I believe it's been ignored.
What is the big focus that you are working on now? Now we're talking about the health of the brain, trauma, whether it's a physical trauma or mental trauma. We know now from a functional perspective, it impacts the whole body. A straight line is to the gut microbiome. And then we know the gut microbiome, if that's impacted, it can lead to inflammation. Are you using this sort of circular event in the body as one of the bases that you're treating depression and suicidal intentions?
Absolutely. There are many roads to inflammation, and the research is quite clear. Any path increases suicide risk. So it could be a head injury, trauma to the brain, concussions, traumatic brain injury, 3 to 4 times increased risk of suicide. It could be early trauma as a child, creating chronic inflammation. It could be sleep deprivation, inflammation. This is the first year that the traditional psychiatric community, American Psychiatric Association, put a full chapter on sleep in their suicide assessment and treatment manual. So sleep deprivation, and then infections, whether it's COVID or Lyme, chronic infection. So we could go on with nutritional deficiency that affect inflammatory markers, and we know those individuals with higher inflammatory markers, much higher risk for suicide.
Which leads to a really good avenue that we can introduce functional medicine from. And I want to just go back to the brain trauma, because concussions and the awareness now of long-term effects of concussions, this too is just recent. Recent within, the scope of science, that we've come to appreciate the long-term impact of concussions. If you are a person who has had a concussion, or if you're the parent of a child, that's been involved in sports or, has fallen, these are not, born with a mental health issue. These are a physical issue that's come. Are there risk factors, or are you, when you've come from a place that, your child has had concussions, are there risk factors that you should be looking out for, either personally or as a parent?
Sure. I mean, I think the research is pretty overwhelming and substantial that the head injury leads to inflammatory markers that increase risk for depression and suicide. So we'd want to address those inflammatory markers, and we can do that with nutrients. And the most important ones that I've seen is lithium. So we have this nutritional lithium, not pharmaceutical lithium. Lithium has been shown to decrease inflammation in head trauma and traumatic brain injury. Omega-3s, there's a good research and many individuals looking at high-dose omega-3s, which can help after a head injury. And I use things like magnesium and a class of phytochemicals called OPCs. All are profound antioxidants in the brain. So we can address the consequences of a head injury by decreasing inflammation, by decreasing oxidative stress as soon as possible. And I think the models are pretty both logical and have been shown to be helpful.
There can be considerable lag between a concussion, a head injury, and the outward display of mental health issues, can there? Or is it pretty soon after?
No, it could be many years. I mean, I think that the process, really varies as to the course of the illness. And if it's a slow inflammatory process, it could be a long time. And again, it's on top of potentially a genetic vulnerability to depression or anxiety. There are many kind of roads that intersect when we're looking at some of these environmental insults.
Do you do genetic testing on some of your patients?
Yeah, I routinely do genetic testing on all of our patients. I think the cost is an issue for some, but there are some genes, the MTHFR that looks at folate metabolism. I think it's very hard to practice psychiatry without understanding that risk factor. And then, if possible, there are other genes that can help either address other nutrients that someone might need, larger amounts, and or adjusting medications.
This is sort of a newer area for a lot of people, understanding their genetic makeup with respect to the functioning of nutrient absorption, detoxification. So it must be quite an educational piece you're giving your patients as well.
Yeah, I think some of it is, if there's a word, de-educate, because I think the Google and the internet oversimplifies, and people get very either excited or upset that they have this genetic polymorphism and they can't take this med or they shouldn't do this. And it's just not that simple. And I think the growth of this concept of genetic testing is really still in its infancy of how it affects clinical practice. But I'm convinced there's some genes that really direct the course of treatment and can improve the course of treatment.
I think what you bring to the table and what is so valuable, especially in this space of mental health, is this hope. I work with some people as well when I'm working with cancer patients that have real issues because of depression, because of worry. And I think when you can speak to physiological and genetic makeups and give them a path that this can be addressed, that has to give the patients you're working with so much empowerment, and that must in itself push your treatments along.
Absolutely, very important. As again, as humans, social beings, the therapeutic alliance is important. And if we can instill hope in our patients, particularly in the field of psychiatry, it is frustrating for so many patients to be just given different pills that never quite address some of the underlying health issues.
I think a sense of control is also at play here. And, with people like you practicing in this way, I can't help but be hopeful that the trends that we've seen over the last while will be turned around. I think we're going to take a quick break here, and we're going to come back and continue our conversation here with Dr. Greenblatt.
They say sometimes you win some, sometimes you lose some. And right now I'm losing bad. I've stood on this stage night after night, reminding the broken it'll be alright. But right now, I just can't. It's easy to sing when there's nothing to bring me down. But what will I say when I'm held to the flame like I am right now? I know you're able and I know you can save through the fire with your mighty hand, but They say it only takes a little faith to move a mountain. Well, good thing, a little faith is all I have right now. God, when you choose to leave mountains unmovable, oh, give me the strength to be able to sing. It is well with my soul. I know you're able and I know you can save through the fire with your mighty hand. But even if you don't, my hope is you alone. I know the sorrow and I know the hurt would all go away if you just say the word. But even if you don't, my hope is you alone. You've been faithful, you've been good all of my days. Jesus, I will cling to you, come what may, 'cause I know you're able, I know you care. I know you're able, and I know you can save through the fire with your mighty hand. But even if you don't, my hope is you alone. I know the sorrow, I know the hurt would all go away if you just say the word. But even if you don't, my hope is you alone. It is well with my soul. It is well, it is well with my soul.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back, everybody. We are talking with Dr. James Greenblatt. We're going to continue our conversation on this very important topic. Dr. Greenblatt, one of the areas that you addressed, I've read a couple of blogs, and one that really got me going, got my attention anyways, was your association and the connections or lack of connections between cholesterol and mental health. And I think this cholesterol and cholesterol management, this is one of these topics that seems to me to be picking up speed, and especially in this space of mental health. And could you explain to us what is the connection of cholesterol and brain health and association to mental health?
Sure. I mean, I think we can start with just the one of the largest groups, or most profitable groups of medications, the statins, which lower cholesterol. And these medicines now have a FDA warning that there are cognitive side effects. It can affect the brain if the cholesterol levels go too low. And those side effects typically are memory related. But the work that I've been most involved in is, uncovering a subset of individuals that have what we call very low cholesterol. And these are cholesterol numbers, under 140 total cholesterol, and normal is 175. And these individuals, it has nothing to do with diet. Many of these are young adults who are eating a lot of fat and junk food, but there's likely a genetic defect in cholesterol synthesis. And we have 30, 40 years of research that those individuals that have the lowest cholesterol have the highest risk for suicide. And it's actually aggressive suicide. So these are impulsive, aggressive individuals. And again, it's not one paper or 10 papers. There's probably 50 to 100 research papers going back 30 years looking at this relationship. And I see it in my hospital. I work in an inpatient psychiatric hospital, and I admit patients that came in for violent suicide attempts, and they might have total cholesterols of under 100. We've seen 60, 70, 100, and these are dramatically low, unrelated to diet.
Interesting. Now, to play devil's advocate here, could the use of statin medication, when we're talking about heart health, the overriding challenge or the call to action is to drive cholesterol down. I think, again, as I stated earlier, I think the knowledge of the importance of cholesterol and maybe revisiting some of these numbers seems to be echoing in the background. Do you see any association with the dramatic rise in the use of statin medications and the increase in suicide?
I haven't, because I believe that these are separate groups, but I don't have any research to support it. I believe the statins bring cholesterol down to numbers around 140. And most doctors say, fine, the lower the better. They have no concept of low cholesterol. And what I've seen in the office over years is either their spouse bringing them in or family members. And these individuals are depressed, lack of motivation, and memory issues. It is not the same group, very low cholesterol, due to, I believe, genetic reasons that are much higher risk at suicide.
That almost sounds like some of the symptomology of Alzheimer's disease.
Absolutely, yes.
Explain to us what the function of cholesterol is in the brain. Maybe we should, make a framework around this so people understand why driving cholesterol or having very, very low cholesterol is detrimental to mental health.
Well, I mean, we could go on for hours, but this molecule, this fat that we've kind of bemoaned, for 40, 50 years now, is this evil chemical. First of all, cholesterol makes every steroid hormone in the body. There are hundreds, but the big ones we all know of: estrogen, testosterone, pregnenolone, progesterone. I mean, those are all made from cholesterol. How about vitamin D? So you make vitamin D from cholesterol when sun hits the cholesterol molecules in the skin. And then in the brain, cholesterol stabilizes the membranes in the brain. So neurotransmitters like serotonin function optimally. Other neurotransmitters like oxytocin, which is kind of our social bonding chemical, those are all directly related to cholesterol. So it has essential functions across all of human physiology.
And another one that comes up is vitamin D. You mentioned vitamin D in passing and the omega-3s, but vitamin D seems to be important for every single aspect of health. How does it relate to brain health?
Well, I mean, I think over the years it's got ignored because we focused on bone, then we jumped to cancer, and now we have great literature on COVID. But the mental health literature is just as strong, and I don't know how any psychiatrist could practice without looking at a vitamin D level. Vitamin D is a rate-limiting step in the synthesis of serotonin. You can't make serotonin without adequate vitamin D. And we have studies looking at depression, looking at dementia and Alzheimer's. And, my recent work is suicide. So the military has done studies, other countries have looked at studies. The lower levels of vitamin D, the higher risk for suicide. It is simple and really tragic that it's not a routine test that psychiatrists are looking at to support a preventative model of mental health.
And the last sort of supplement that we talked about before we get into more socioeconomic issues is lithium. Now talking off air, I don't know if we can get that in a supplement at all in Canada here. Why is this? Why not? Number one, are there dangers with lithium? And further to that question, how are you seeing such huge benefits by microdosing it?
Yeah, lithium, first of all, is a natural mineral in the soil. In every drink of water, if you drink from a tap, would have some lithium. So it's in the earth. It's been in the earth since the Big Bang, 13 billion years ago, and it's essential for brain function. Somewhere between 1 to 3 milligrams is what we get every day in our diet. And what we have demonstrated since the 80s around the world, actually, in many, many countries, is that the levels of lithium in the drinking water, in your tap water, can predict suicide rates in a certain community. And again, this has been done off and on for these 40 years. And in 2020, there were 3 major studies that looked and confirmed the same relationship. And whether it's Greece, Japan, the US, England, different states in the US, I think there are 13 or 14 different countries, and they've all demonstrated the same thing. The amount of lithium in the drinking water, microdosages, will affect suicide risk. And then if we jump all the way to pharmaceuticals, we've also established that individuals who take prescription lithium have decreased suicide rates. That is a well-researched academic fact. Nobody would argue with it. Bipolar patients who take lithium lower suicide. If you're not on lithium, higher suicide rates. So we know microdoses help, and we know these pharmaceutical doses. And my work has been in the nutritional supplement world, dosages that you take as a supplement from 1 to 5 milligrams. And it is the most significant intervention that I use in my practice. We use it for mood, irritability, impulse control, and decreasing suicidal risk. Lithium has been shown to decrease suicide. And again, we have to do everything we can to support that model.
Well, what is the fear of taking too much? It sounds like, the microdosing and the fact that I don't think it's readily available. Is there a fear of if you take too much of it, can it be tragic?
Well, pharmaceutical dosages, and the numbers are important, 1,200, 1,800 milligrams, does have side effects and can affect the kidney and the thyroid. The microdosages, again, which might be in somebody's water supply, I have not seen side effects in using this for 30 years. And there's none that's been reported. I think that, there are many countries, the US and other countries around the world, where you can buy lithium over the counter. Other countries, you can't without a prescription. But I see the low dose, 1 to 10 milligrams, not having any side effects. There's no blood level, and it is has benefits both for, well, we're talking about suicide prevention, but there's growing literature in the academic world about its effect on prevention of dementia and Alzheimer's.
Is this something that so you just said there are no blood levels, so it's not a blood test, but can you test for this level? Is this, vitamin D is in the blood, we have to test so we don't overdo it or under have it. How do you know if you want to put someone on lithium?
Well, some of it's based on clinical symptoms. Some of it's family history, and the work that we've done and what I've learned over the years is those individuals with family histories of bipolar or substance abuse or suicide, those individuals, I believe, have a higher need for lithium. And then we can do a trace mineral hair analysis. So we can look at levels of lithium in the hair, most people would have lithium in the hair, and there's a subset of individuals that we're finding with undetectable lithium, and sometimes that can guide our treatment. But again, don't forget that our psychiatrist colleagues, without any testing, someone who's depressed and suicidal might put them on lithium 3, 6, 9, 1200 milligrams to prevent suicide. And what I'm talking about, and we're actually putting together an international conference in April on this topic, is can we use low dose lithium to achieve the same benefit?
Or as a preventative?
Correct.
If you're seeing genetics coming out where you see possibility, a trend in the genetics, or if concussions come into play, this could be a preventative.
Absolutely. When we look at a functional psychiatry model, prevention is really the goal. And psychiatry, like most of medicine, it's not really focused on prevention because there's no money in it. But that would be the goal here, is do we understand risk factors, psychological, cultural, environmental, as well as these biomarkers, and then treat them before the onset of the symptoms.
Well, therein lies the problem, right? I mean, you could be living a happy life and have a trauma, have a pandemic, have a loss of, a loved one that can trigger a mental health issue. Where does functional psychiatry come into this? The socioeconomic, the poorer population where we are seeing more rates of suicide. How are they interwoven when you're not dealing with an underlying, or maybe you are, but in some cases not dealing with an underlying propensity towards a mental health issue?
Yeah, I think it's always critical that we kind of balance in our heads this kind of genetic, environmental, dance, if you will. So let's say we have a tragedy in our lives, a pandemic with the loss of a loved one. There's grief and there's stress, and there might be a family of five that are dealing with the grief and that loss. But one of those individuals might have a particularly genetic polymorphism for, folate deficiency or B12. And that individual course of illness could go from a depression and grief to something more significant and increase inflammatory markers and increase risk for suicide. So I think even though we have an outside environmental stressor, that we always have to kind of dig deeper and see if there's some biomarkers that would place that individual at higher risk for a more significant downward spiral. And I think often we can predict that.
It's amazing. And again, just something that you touched upon earlier, the first half of the show, that I want to bring up again, the importance of sleep. And sleep has been a challenge for a lot of people over the last year. It's been a tough year for everybody. How does sleep impact our mental health?
Well, I mean, I hope the good news is it's getting more both research and press. And I think it's, up there with exercise, maybe even more so, that the quantity and quality of our sleep affects every major psychiatric illness. And one of the variables is sleep deprivation causes inflammation, which exacerbates every mental illness. So it is probably the single most important lifestyle thing that one can do. I might throw it even above exercise as we get more and more research, but it is a lifestyle intervention where whatever it takes in terms of supporting sleep will help the underlying symptoms of mental illness.
Are you doing any type of clinics or group work where you're educating people on things like this? Is this part of a plan that you have, or a therapy?
Yeah, most of our work, or my life now, is focused on our educational platform, Psychiatry Redefined. So it's psychiatryredefined.org. and we are teaching clinicians, functional psychiatry. So there are courses, and there's longer trainings and fellowships, ADHD intensive. So we have cover most of the major mental illnesses, looking at these underlying metabolic, biochemical, and nutritional deficiencies.
Are you seeing patients still, or are you totally moved into the educational space?
I'm consulting with physicians. I'm not taking on new patients, but I'm working with consultation with physicians around their patients.
Now, if people are interested in finding out more about functional integrative work in the psychiatric field, is your website someplace that they can look at for information like that, or do you refer out to other people?
Yeah, I think the website, psychiatryredefined.org, or mine, James Greenblatt, MD, has a lot of information. There are practitioners who are taking new patients listed on the website in various areas around the country.
Well, I want to thank you so much for joining us. It's such an important topic to discuss. And I think the more practitioners like yourself are putting the mental health space into the functional and into the hands of individuals where they can understand that they have control, they have pathways. And again, just by talking and equipping them with questions to ask, I think is so vitally important. And I think with people like you, the future of mental health is very bright. So I really appreciate you taking the time to be with us, Dr. Greenblatt. Thank you so much for being on our show.
My pleasure, Kathy. Take care and keep up the good work.
Thank you very much. And everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by